Hello, I'm Professor Mohamed Khadra and I'm pleased to present you this video on pyeloscopy. The aim of this video is to help you understand the operation, its main side effects, and to prepare you better for your upcoming operation. This video is intended to be used in conjunction with the information leaflets you've been provided. Pyeloscopy is the introduction of a thin fiber optic telescope to the kidney from the bladder through the urethra. The scope is flexible, which allows us to see the entirety of the kidney drainage system. Once the scope has been inserted, a port can be used to introduce laser fibers to fragment the stones, which can then be removed with micro baskets using the same port. Kidney stones up to 2 centimeters in size can be treated using this method. A midstream urine test is usually needed before the operation to ensure the urine is sterile and to minimize the risk of infection. Please make sure you inform us of any blood thinning medications or conditions that may affect how we perform the procedure and how you heal after the procedure. A full general anesthetic is normally used and you'll be asleep throughout the procedure. If you have any allergies, be sure to let the anaesthetist know. On the day of surgery, you'll need to bring all the imaging that you've had, such as X-rays, CT scans and ultrasounds, and bring your usual medications. Your anaesthetist will meet you before surgery to take a thorough medical history. This person will be responsible for your safety while you're under general anesthetic. The procedure usually takes anywhere up to 2 hours, but usually about 30 to 60 minutes. It is normal afterwards to feel the need to urinate frequently, and there may be blood or discomfort when you do so. Sometimes you can get a stinging sensation. These symptoms settle after a few days. An oral medication such as Ural can ease the discomfort experienced while urinating. It's available over the counter from any chemist. A temporary urinary stent or a plastic tube may be left inside the kidney for a short period after the surgery to ensure the kidney is able to drain without the risk of blockage. This stent may have a string attached. Please do not attempt to remove this yourself, as this will be removed by me or our nurses after a few days to a week. After the surgery, you will need to make an appointment to have a follow-up consultation in the rooms. The time will be recommended to you in recovery. To minimize the risk of an infection or blockage, you'll need to drink at least 8 glasses, which is about 2 liters of fluid per day, in addition to taking oral antibiotics for 5 days. A script will be provided to you. To minimize post-operative pain, simple analgesics such as Panadol or Nurofen are usually all that's required. Occasionally, stronger medications such as Panadine Forte may be necessary. You'll not be able to drive for at least 24 hours after surgery as you've had a general anesthetic. The general side effects include the risk of general anesthesia and possible heart and lung complications. Hospital-acquired infections can occur in about 1% of patients. Formation of blood clots in the legs and lungs is uncommon but can occur, and we certainly encourage you to move your legs and return to walking as soon as possible to prevent the formation of blood clots. Your anaesthetist will discuss this in more detail. The side effects that are related to pyeloscopy are the chance of infection, which is about 5%. Significant bleeding is extremely unlikely, as is a blood transfusion, but can occur. An injury to the ureter is a risk, however a very small one, of less than 1%. Sometimes we are unable to treat your stone and need to place a stent in the ureter to allow it to expand and relax. We can then perform a second procedure in 3 to 6 weeks, during which we take out the stent and attempt to perform pyeloscopy and treatment of your stone again. After any surgical procedure, there are known side effects. But if you're concerned or the side effect is unexpected, please don't hesitate to contact my rooms or present yourself to the nearest emergency department. Hopefully, this video has presented you with an overview of the procedure. you will have already received the patient information booklet, and we've had discussions during our consultations. If you have any questions about any of the contents of this video or the information sheets you've received, then please don't hesitate to contact the practice or to make another appointment before your operation.